We can start, right?
Yes, when you're ready.
Okay, I am ready. So, hello everyone. I would like to welcome to our second Nightingale Challenge 2023 webinar, which is titled Cancer Nurses and Psychosocial Distress. It is an honor to be a chair of this great webinar, and thank you very much for this chance, first of all. Today we have two great speakers, and first of all, I want to introduce myself. My name is Tuğba Pehlivan. I am working as an assistant professor at Istanbul Aral University, Faculty of Health Science at Nursing Department. And I graduated my PhD program in psychiatric nursing at Koç University. And I also worked as a cancer nurse and educator nurse for 11 years. I am a member of our National Oncology Nursing Association, and I am currently member of EONS Young Cancer Nursing Network, Turkey national representative, and also I am a member of EONS Education Working Group. My research area is psycho-oncology and psychosocial care of cancer patients, compassion fatigue, resilience, and empowerment of nurses, primarily cancer nurses. And our second chair is Cláudia. Cláudia, you can also introduce yourself.
Okay, hello everyone. So I will shorten a bit, just saying that I'm a nurse since 2012, and I've been working in UK, in Portugal, where I'm from, and in a surgical ward, and both countries was in a surgical ward. And I had a master's, and my master's was about delivering bad news to the patients. So I'm very interested in these kind of teams like today.
Thank you, Cláudia. Today's both subjects are really important for cancer nurses, actually, because we know that cancer nurses are at risk for burnout and psychosocial distress. So we will listen these two important concepts from our speakers' perspectives and experiences. After our first speaker, there will be time for Q&A, so you can write your questions to Q&A box. Also, if you want to talk or ask a question, please let us. And I would like to invite our first speaker, who is Helena Lynch. She will speak about psychosocial distress. And Helena has Bachelor's of Nursing degree at Adult Nursing University of Southampton, and she graduated Diploma Cancer Nursing University College Dublin. She completed her Master's Science in Nursing degree at University College Dublin. Helena is a clinical nurse specialist currently working with the Department of Cancer Services in University Hospital Limerick, Ireland. Her master's science thesis explored how oncology nurses experience psychosocial distress. Throughout her career in oncology, she has worked in inpatient units, outpatients, and within cancer clinical trials. She is a member of the National Executive Committee of the Irish Association of Nurses in Oncology as a young cancer nurse representative and a representative of the Young Cancer Nurses Network within EONS. She is also a member of the EONS Communication Working Group. She received the Irish Association for Nurses in Oncology President's Prize in 2021 after presenting her research nationally on oncology nurses and their experiences of psychosocial distress. After receiving this award, she traveled to Memorial Sloan Kettering in New York for placement. Yes, Helena, it is your time. Please.
Thanks very much, ladies. I'm just going to start sharing my screen here just with the presentation that I have. And I will talk you through it. Perfect. So I am just going to give a little presentation about my master's thesis. I looked at oncology nurses and their experiences of psychological distress back in 2021. So I'm just going to talk you through what I found in the research back then. So I don't have any declarations of interest to declare, but just that I am a member of the EONS Communications Working Group. So the aim at the time was to undertake a synthesized review of the best evidence available to answer the question, how do oncology nurses experience psychological distress? And the objectives were to gain knowledge to aid with identifying appropriate support strategies that we could use. And these strategies could be implemented at a local level and hopefully eventually more at a regional or national and international level. Because we are a group of nurses, unfortunately, that are just we can be prone to this with what we deal with. So it was just an interesting question to find out what's going on out there. So the bit of background in regards to the research, just there was a growth in both the incidence and prevalence of cancer, which was giving rise to an increasing workload. And oncology nurses are expected to provide ongoing psychological care to patients that requires a lot of increased emotional labour. Due to the nature of our speciality as well, we're particularly vulnerable to experiencing psychological distress. I was looking at identifying the elements of psychological distress by those who were experiencing it in their own words. And it was aimed to allow solutions to be recognised and implemented to avoid stressful situations. So just the rationale for the review and why I undertook it at the time. So the rationale was for focusing on oncology nurses' experience of psychological distress, stemmed from my own experience of working as an oncology nurse within the Irish healthcare system. So over time, I just witnessed the effects of an increasing challenging work environment, one which is impacting year on year on both myself and my colleagues' physical and psychological health. And a review of the literature just to explore how oncology nurses who are experiencing psychological distress was necessary to investigate what forms it can take and what we can do in our field to try and look at what basic understanding we have so we could tackle the problem more appropriately. So the term psychological distress is really broad, but elements such as compassion fatigue and work-related stress and burnout were being investigated within the nursing profession. So I umbrellaed all those terms to make the discussion around psychological distress. As I mentioned earlier, just due to our speciality, we are particularly vulnerable to all of those elements mentioned above. But to develop the actual research question itself, I did a PQ format, so that was population, intervention, comparison, and outcome. So, and as the phenomenon was a lived experience, which is psychological stress, I explored it using a PST framework. So the population that was being looked at the time was oncology nurses, and the situation was psychological distress, and there was no time limit. So I undertook a comprehensive systematic search in the literature to answer the question, and I used 3 databases, which were CINAHL, PubMed, and PsycInfo. So I undertook with the PRISMA, so the preferred reporting items for systematic reviews and meta-analysis diagram to break down the search strategy. That's on the next slide. So as with all research, you need a logical review to understand what's going on, what's been done, how is it found, and what's being reported. And those of you who may be interested in research or wanting to do research possibly down the line, this is one of the first things you'll do for building up your strategy and your search strategy. So you can just see here, I know the slide, it might just be a little bit small to read, but I'll just kind of talk you through it just so you know how I broke everything down at the time. So records identified through the database search, that was through all 3 of the databases that I mentioned. There were 341, and I also got some additional records just through other sources. That was grey literature and everything else. That was 3. So in total, I identified 344 records. I excluded 224 and I screened 276. So I excluded any papers that weren't mentioning nurses. So I might have come across a couple of papers that mentioned other professions that we do work with, such as occupational therapists, physiotherapists, and doctors. But for my particular question and the cohort that I was looking at, I was not looking at them, I was looking at oncology nurses. So we did not mention oncology nurses, it wasn't included in the analysis. So I was also looking at all the terms I mentioned earlier in psychological distress, so compassion fatigue, all those other relevant words that make up the acronyms. If they were included with the experiences of oncology nurses, they were included in my review. So then in total, I had 52 texts that were eligible. And then I excluded full text articles then as well with reasons. There was 44 of them excluded. So a lot of them, again, could have been excluded just because it wasn't particularly focusing on psychological stress elements, which is what I was trying to tease out. So in the end, I ended up having 4 qualitative studies and then 4 quantitative studies. So after a rigorous review then of the literature, I found 8 articles that were the most relevant in investigating how oncology nurses experience psychological distress. So I had 4 qualitative studies, and I focused in on the concepts of trustworthiness under the headings of credibility, transferability, dependability, and confirmability. And that's how I analysed qualitative studies. And then for the quantitative studies, I looked at the concepts of reliability and validity, and they were under the headings of reliability, replicability, and validity. So just some key findings from the qualitative studies across the board. Phillips and Volker found that oncology nurses are exposed to a significant amount of suffering and loss. And they also suggested that novice oncology nurses can be unprepared for that and for the ordeals of being an oncology nurse. There are a lot of nurses who come out into the profession, they're new graduates, and they have a keen interest in a speciality, and we welcome them with open arms. But sometimes it can be a lot when you're a newly qualified nurse going into such a speciality, and to be prepared for that. And similarly, Finlay and Shepherd found that oncology nurses and those new to the profession are at a bigger risk of compassion fatigue, which is a form of psychological burden. So the first few patients that a nurse might care for, there's an increased risk because they're kind of putting all of their boundaries kind of there. They're kind of nearly giving everything as a nurse. And sometimes I suppose it's trying to find the line of kind of where to stop. So you don't kind of burn out too quickly. And Gunson et al. And Tagliate et al. As well also provided research showing that oncology nurses were continuing to have difficulties and barriers with their thinking, and then thinking that they're not caring sufficiently because they're not giving enough. And then they were experiencing negative feelings around that and changes to their own impact, and it was impacting on their own life and their empathy in their care. And then with the quantitative studies, so Aaron's Pages et al. Found that the presence of satisfaction did not migrate to compassion fatigue, which was a bit contrary to some of what the previous evidence suggested. And they also investigated into social demographic variables and psychological variables in relation to professional qualitatives. And they found consistent data that the experiences of psychological dispositions and that oncology nurses are really vulnerable to compassion burnout, just with specialism. And the stress levels were also found to be really high in oncology nurses by Wahlberg et al. But there was just caution with those results because when they were asked in that particular questionnaire, they were asked at a time of very high distress, so it's just be cautious with the interpretation of those results. And while Ornan et al. In 2015 found that the perceived stress levels of oncology nurses to be low, suggesting so sometimes they might not feel that they perceive themselves as stressed, even though they could be. So findings across all 4 qualitative studies provided a useful phenomenon explanation as to how nurses within the speciality were feeling, and development of sufficient and relevant evidence and education surrounding peer debriefing seemed to be the most benefit for the nurses themselves. So adjustments in trialling peer debriefing for a period and investment in formal education was allowing nurses to gain a better understanding of their own emotions and how they can improve healthcare culture to lessen the silence relating to the emotional well-being. So sometimes I think possibly maybe as nurses we kind of just go on, get up, go on with the job, and kind of, you know, you kind of can't really look after other people if you don't look after yourself as well. So all 4 studies acknowledge that they were cross-sectional in nature. So this is in regards to our quantitative stuff, so that doesn't always necessarily establish causation. So just caution again as per when you're looking at the results. However, they did provide important statistical data surrounding the aspects of psychological stress, which we face sometimes, some of us on a daily basis. There is a significant risk of compassion fatigue and burnout within the profession and within this speciality. We do need psychological support and guidance and the ability to empathise and to understand our emotions to provide effective care. And interventions should be aimed at coping with self-efficacy and resilience and improving our professional well-being and our psychological flexibility. So further research, I found just further research was needed into the phenomenon itself, just among my particular cohort of Irish nurses. There wasn't a lot of research at the time. A lot of what I found with all of those articles that I just gone through there, they were from the United States and Europe. So I just said another benefit at the time it would have been good to see maybe if there was a little bit more just from my own home country, and the allocation of further resources. Just looking at, you know, we've a lot more enhanced roles now with clinical nurse specialists and advanced nurse practitioners. So just, you know, the role is ever adapting, but just looking at not forgetting those as well, you know, kind of just going from the start to the kind of working our way up. So if we're ever kind of doing research, just to kind of include the whole umbrella of oncology nurses because we're all in specialism. So just a couple of strengths and limitations just with the research itself, as you know yourself with qualitative evidence, it was actually pretty limited. I was expecting to see a little bit more qualitative evidence when I was undertaking the question, but there wasn't actually as much as I thought there would be out there at the time. And so there was a lot of descriptive cross-sectional studies, so they're not the highest form of evidence. However, they can capture an increased response due to the nature of the research, making the results themselves a bit more generalizable. And obviously just, I noted afterwards, just with one of the terms, I didn't include the term cancer nurse when I was undertaking my research at the time. And it is a general term that we use in oncology, so there could have been a couple of articles that were lost because of that. And obviously it was only 3 databases at the time that I did. So obviously if you expand out a little bit more, you may get a little bit more back. So just in conclusion, the prevalence of psychological distress, it continues to be quite high, with those providing, with us ourselves providing all the support for patients, but sometimes we're not getting the support back ourselves. The cancer rates globally, we can see they are increasing. And so it's important to know that because our caseloads are going to be increasing with that. So we need to have necessary supports available to be dealing with psychological distress. And overall, the appropriate use of strategies such as planned peer debriefing and just staff well-being, they can really help staff just for dealing with times where they just need times to debrief and just kind of catch their breath on what they've been dealing with. And that does improve the quality care for patients. So it's just a list of references there, guys. I'm just at the end of the slides. If anybody's interested, I can send you on my slides as well. That's no problem. So these are all the articles that I used at the time. And just for an acknowledgement as well, just to acknowledge everybody who helped me at the time, because this was master's research. So just to Patricia Fox, she was my supervisor in UCD over the 2 years when I was doing my diploma and then doing my master's. Deirdre O'Donnell was great as well for her guidance and support at the time. She was head of the programme. To all the work colleagues who helped and supported me throughout the year when I was undertaking everything, because they listened to me quite a lot, talking about everything throughout the year. They were amazing. Just to our own hospital librarian, she's moved on to a different job now since, but she was extremely helpful when I was doing my search. And to all the family and friends who helped me, who my husband Kevin, he was my fiance at the time, he's now my husband, and also to my mum, they were a great pillar of support. And also to Anna, who was my friend, who's actually a teacher, not a nurse, but she read all of my chapters. Shirley, who's one of my colleagues, who's gone on to become an advanced nurse practitioner. And also to Charlotte, who was an amazing colleague who I worked with, who unfortunately has passed on since I've written this research, but she read all of my chapters as well. And she was a fantastic nurse and a great inspiration for undertaking this project. And if you have any questions, I'm happy to answer them.
Thank you very much, Helena. This was great review, actually, excellent work. And we have time for Q&A, actually. I am looking for, is there any question from the audience? Did you publish this work, Helena?
No, I actually haven't published this work, but I am kind of looking at it now just for I had kind of bits and bobs kind of put aside just for getting it published, but I am hoping to get it published. I'm just trying to think of now kind of building the whole thing and just kind of taking it out of the research kind of context to kind of get it ready for publishing, and you know what articles will kind of suit and what papers and that would suit for taking it. But I'm hoping to get it published.
Yes, I think you should also publish, because this is really great work, and psychosocial distress is really broad term, and you actually mentioned, and I'm also working on primary compassion fatigue for oncology nurses. And if there is no any question, I have one for you. From this review, you actually review many research studies, and is there any recommendation for nurse managers or hospital administration, or what is your inference? Because this term is actually important for hospital administration and the nurse managers also, because they can follow their nurses in terms of burnout or compassion fatigue. I don't know. Is there any specific recommendation for them?
There wasn't anything in regards to specific recommendation for them for the research that I found at the time. The main thing that I found that came out of what I had read was that the most benefit intervention that oncology nurses found was actually peer debriefing and even planned peer debriefing. So not necessarily, I suppose as nurses, sometimes we've had those shifts where, you might get together for a peer debrief because it's just been that type of shift where one thing after another may have happened. So that's not necessarily planned. You can't do it at the time. But other nurses had found that when they had planned peer debriefing, so it could have been maybe once every month on a staffing level that was arranged, and everybody attended it at some point, as much as they could be together, or they might have been split off depending on the shift workers with the managers. As long as something like that was planned and they kind of had something to go through together, they found that very beneficial. From their own level. And some others as well found that they might go through different pathways. So they might have employee assistance programs where they would go to a registered psychologist to go through anything that they had been through. And it was recommended by some hospitals that was planned as well, at least once a year. So all staff members would go at least once a year. They would have to go at least once a year. And they did find that beneficial as well. So I think the intervention of peer debriefing was what I found seemed to be the most beneficial. Now, obviously, other things, with staff, if you can kind of maybe introduce smaller things in a wellbeing centre, such as, classes for yoga, things like that, maybe on site as well. They were beneficial too. But the one that really stood out at the time, and that seemed to be the most beneficial, that everybody could try and implement even on a local level, was definitely peer debriefing, and having planned peer debriefing as well, at least once a month.
Okay, thank you very much.
No problem.
There is no any question, I think, but we have time. If you have any question, please write to Q&A box. Okay. Helena shared many important results with us, actually, about psychosocial distress of oncology nurses, and also your key message for future studies. They are really important. And thank you for this great presentation, Helena. We can go ahead with our second speaker. Could you please continue, Cláudia? Thank you very much.